was in high school, my mom was diagnosed with ovarian cancer, and it was an RN that helped me understand her diagnosis and helped me cope with what was going on. So it kind of became an interesting path for me to take. And then after I lost my mom, I moved down to be with my grandparents, and I've been in nursing probably almost 29 years now, in the emergency room for 11 years. I find it very rewarding to contact and develop a bond with my patients. Sometimes it's very, very brief because they're only in shortly, but being able to reach them, to contact them in a human level, that's what is very rewarding for me. A lot of times, nursing doctors come in and we throw lots of jargon at patients and they don't understand it, and it's just this beautiful light bulb when you can help them, well, this is what that really means and this is what we're looking at, and it makes them feel maybe not comfortable with their diagnosis, but at least gives them, again, a path, some way they can find to start coping with. Most recently, I had a patient who came in, found out she was going to have surgery, became very concerned, anxious that she was going to have surgery, and wanted to have some of her people from church come in and be with her. And unfortunately, being in the emergency room, it's considered a dirty area, so we're not allowed to have visitors. So I hooked her up with our chaplain, and our chaplain was able to come in and do a FaceTime with the two people she wanted to have come in and pray with her. And she was able to share with me that that helped her quite a bit and made her much, much more calm before she went up for surgery. When we first got COVID, or the spread of COVID, or the alerts about it, it was extremely frustrating. You'd come in every day, something new, the information that was being distributed, nobody really knew. Everything changed minute to minute. You'd start out in one area and then, we had to change all our techniques, and of course wearing the masks. When you're trying to communicate with people, your mouth is what people see. A lot of your character, a lot of how you come across to someone, we see in the lower half of our face. And then you're suddenly wearing this band and people can't see it, and they're like, are you really telling me the truth? Are you being honest with me? So that part was very frustrating. The rewarding part, Teresa and Casey are excellent managers, and they have always supported us and tried to give us all the information that they can, and it's made a frustrating time better. And in the emergency room, we're like one great big family. So if you're having a bad day, you just go lean on somebody else and they pick you up. And then when they're having a bad day, you pick them up. It makes it very, very nice. It's a very family unit down there. Makes it very comfortable. And then of course, another frustration was going home. I don't want to take home COVID to my family members. So changing out, learning to put a change room in my garage so I didn't take any of my dirty clothes in the house. And now, with the vaccine and everything, being able to go home through the front door like I used to is very nice. We have somewhat of a set protocol now that we follow, as far as wearing, hand washing, masking. How many times have we tried? I think in the last 10 years, we've had the cough into your arm and wash your hands for the flu. And nobody really paid a huge amount of attention to that. Now that we've got COVID, a lot more people you see them washing their hands, coughing appropriately, wearing the masks, getting the vaccine, getting double vaccinated myself, and having my husband now double vaccinated. It's a sense of, we're coming through this. The sunshine's there. We're almost able to go out and party on the beach again,